I was just going to talk briefly about measles, which is always just a fun topic. As everybody knows, there's a lot of kind of waxing and waning, and I think with the internet, it gives people a lot of false information what to do about measles or any kind of vaccinations, and kind of the importance of them gets downplayed. I was going to talk about one particular aspect that is kind of interesting, where we don't really see some delayed effects for about 7 to 10 years later. With measles, though, just kind of as a kind of just brief overview, when it is infecting somebody, there is kind of a few things that are important to notice. One is that the period of infectivity is kind of not always correlating when their symptoms seem to be the worst. So sometimes that rash doesn't really develop, characteristically until they're like maybe 4 or 5 days into their illness. They already can be contagious prior to that onset. And then it doesn't always require that person-to-person transmission, and so that's why you hear about a lot of these kind of scares at Disneyland or other places where, there really can just be a very kind of spread like wildfire as a result of that. The way that it infects the body is it really does affect the immune system primarily. So T cells are involved, which are a very important part of the immune system. A lot of the dendritic cells of certain parts of the body are kind of the initial players for your immune response. And so when that's infected, bothered, there can be a lot of subsequent infections. So big common, complication, especially in kids, is pneumonia. It's one of the biggest problems in kind of the acute measles problem is they get a pneumonia that can be very problematic. There can be pretty much any other organ system, diarrhea, gastrointestinal disease, oral mouth lesions can be affected. But then, like I said, there's one that I wanted to talk about that I'm not particularly familiar with, but that we should be aware of, and it's called Subacute Sclerosing Panencephalitis, or Sspe. So what's interesting with this is that it's a disease that doesn't really manifest for about 7 to 10 years after infection. And so when we see kind of these, resurgences of measles, so in like the early 80s, there was a time where people were kind of waning on their immunizations a bit, and then we see the effects later on. Probably when people were at their best in their immunizations was kind of late 70s, early 80s, as far as kind of things coming around, people got on board with it. And so these cases kind of per million dropped to like less than 0.06 cases per million of this Sspe. And then as higher cases, have come around with kind of, waxing, waning immunities. It's been as high as 1640 per million. So you can imagine from 0.06 up to 1640 per million. And that's, again, we don't really see the effects till 7 to 10 years later. So I think, in the next 5 to 10 years, we might see more and more cases of these, especially as we've seen measles on the rise currently. What's terrible about it is it's a central nervous system disease. It is progressively fatal. There's really not a great cure other than supportive care for that. And so people can just become neurologically devastated and basically just encephalopathic. And again, it can be a whole other course just talking about that. But the progression of that is something that we don't see the effects of. So I think as healthcare providers, we have that duty to really encourage vaccination. I feel like in the ER, we probably do see the patients who are vaccinated. They tend to kind of rely on what we believe, to be the correct treatments, but we still see some come through from time to time or that are not up to date on their immunizations. So we, doing our best to educate people and kind of, be aware of those things rather than, it's just not a bad infection where they get a rash and then they're okay later on. It can be some progressive, fatal neurologic deficits that come. So that's it for measles.
All right, thank you. Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.